Okay. My name is Dr. Wala Khairi. I am an Associate Professor of Public Health at the Faculty of Medicine at Cairo University. Today, I will introduce to you the topic of medical ethics and confidentiality. What we are going to learn today is how to define the key concepts related to medical ethics, differentiate between legal and ethical obligations of healthcare providers, explains the importance of patient confidentiality in healthcare settings, define and analyze ethical dilemmas, gain knowledge to make ethically sound decisions in clinical situations, and finally apply ethical principles to different case scenarios. What is medical ethics? What is meant by medical ethics? Medical ethics is a discipline in which it is considered the value dimension of human decision-making and behavior. Medical ethics is very important as the importance of giving medical services. But here we are not talking about the quality dimension of the service. We are talking about the value dimension of the service. Medical ethics means the morality in healthcare. And what is the meaning of morality in language? Morality means the good, the bad, the right, the wrong, the evil, the justice, or the injustice. According to all these definitions, ethics is a matter of knowing what is morality. Okay, what is morality in the discipline of medical care? The word ethics is derived from a Greek word called ethos, and ethos means a set of moral principles. We need to know what is the difference between the ethics and the bioethics and the medical ethics. We use these three terms in our practice: ethics, medical ethics, and bioethics. What is the difference between them? First, what is ethics? Ethics is morality. Ethics is ways of understanding and examining the morals in life. What is right? What is wrong? Okay, in the human conduct. What is our behavior in life in general? But bioethics is the same meaning, but when applied to the biomedical practice and research. Here, bioethics is a way of understanding and examining the moral aspects of biomedical practice and research. What is the difference between biomedicine and medicine? Biomedicine is a bigger or a wider branch than medicine. Biomedicine may include veterinary, may include some branches of science. Okay, so biomedicine is a more wider branch than medicine. What is medical ethics? Medical ethics is the application of moral principles and analysis, but in this case, to only medical situations. Why we want to apply medical ethics to medical situation? To guide healthcare professionals in making this ethical decisions. Okay, so medical ethics is the application of moral principles and analysis to medical situations. Very common medical situation we meet every day concerning medical ethics. For example, the doctor-patient relationship, the doctor and his colleagues relationship, the doctor and the society relationship, the autonomy of patients, how to manage the autonomy of the patient, the competence and capacity to make decisions by the patients, the issues related to the informed consent, issues related to confidentiality and medical records, end-of-life issues, reproductive issues, organ and tissue donations, the issues related to reportable illness, the HIV-related issues, sexually transmitted diseases, malpractice, experimentation, and research ethics. All of these are different medical situations that sometimes conflict arise, and in these cases, we must take a decision. What is the center question of medical ethics? The center question of medical ethics is the doctor-patient relationship. What is the doctor-patient relationship? And this is very, very important. All the medical ethics is concerned mainly with the doctor-patient relationship. Why is the doctor-patient relationship? Because the patient is our main concern in medical ethics. We try to make the right of patients or to guarantee the right of patients and also the right of doctors. But here we are more caring about the patient. For example, the beginning and the ending of the relationship between the doctor and the patient. Whether the doctor-patient relationship is a voluntary relationship or no, or not a voluntary relationship. Okay? Or ethics and medical is ethical and legal obligations are the same. By another meaning, medical ethics and the law are the same. No, they are not the same. Okay? Medical ethics and the law are not the same, but they often help to define each other, which is more important and which we have to adhere with if they if the medical ethics and law in a certain situation does not give us the same solution, okay, which we have to adhere to. We have to adhere to the law. So it is the law followed by the policies and procedures in your institution, followed by the medical ethics. Preaching of ethical obligation may not necessarily mean preaching of law. And also preaching of the law doesn't mean preaching of the ethical obligation. For example, if you don't communicate in a good way with the patient, for example, if a patient's come and you are not paying attention to him, you are looking at your mobile, for example, okay? Is this considered preaching of ethical obligation? Yes, it is considered preaching of ethical obligation, but it is not preaching of law. In case of preaching of ethical obligation, this is called medical malpractice or medical negligence. Legal obligation is a general term for any type of legal duty or liability. However, ethical obligation are a set of two standards, okay, that define a moral course of action and draw a line between what is right and what is wrong. What are the ethical guidelines and codes? Ethical guidelines and codes in medical practice serve as a reference point, as a pitch. It serves as a reference point or a cut-off point for healthcare professionals, okay, helping them to take moral decisions and face ethical challenges. They also provide a common set of principles and values that guide healthcare professionals in their interactions with patients and colleagues. What is the historic code of ethics? The historic code of ethics is the Hippocratic Oath. The Hippocratic Oath was since the ancient Greek. What is all about the Hippocratic Oath? The Hippocratic Oath emphasizes principles such as the patient confidentiality, the beneficence, which is doing good, and non-maleficence, which is doing no harm. These are the main principles which is mentioned in the Hippocratic Oath. Here, as you can see, this is the Hippocratic Oath. It was written in Old English, okay? Then comes the Declaration of Geneva. The Declaration of Geneva is a contemporary code of medical ethics. It is adopted by the World Medical Association. It outlines the responsibilities of physicians, and it emphasizes the well-being of patients, respect for human life, and professional integrity. The Declaration of Geneva in general states that the doctor, his main duty is to serve humanity and serve humanity with dignity and integrity. Okay, and that the doctor shall respect the secrets of the patient, the confidentiality of data of the patient, and the privacy of patient. Also, the doctor shall respect and have gratitude to his professors, shall respect his colleagues, and have a duty to teach the juniors, junior staff. What is the most important principles of medical ethics? There are 4 key principles for medical ethics. What are these 4 key principles of medical ethics? They are autonomy, beneficence, non-maleficence, and justice. What is the difference between them, and what is the meaning of each one of them? First of all is autonomy, and autonomy is a very, very important. It is the core of medical ethics. Autonomy also, in other words, means respect for others. How do you respect others? How do you respect your patients? In order to respect your patient, you must allow him to take independent decisions. So, autonomy is related to the right of the patient to take independent decisions. By another meaning, take independent decisions even if he is going to harm himself? Yes, he must take his independent decisions. This is his own body, and he is free to choose what is right for him. Okay? But after giving him the most important information and knowledge about his case. So when he is taking a decision, he must be aware of what are the consequences of his decision. Okay? And if he is still wants this decision, you must guarantee his autonomy. I'm sorry, I will share the presentation again. Okay. So, autonomy emphasized respecting patient right to make decisions about their own health care. It recognized that individuals have the capacity to make informed choices based on their values, beliefs, personal circumstances, culture, traditions, norms. Autonomy includes informed consent, patient education, and to respect your patient choices. A cornerstone of autonomy is the informed consent. What is the informed consent? It is the process by which healthcare providers obtain permission from patients before any medical intervention. It involves disclosing relevant information about the proposed treatment or procedures. Patient must also have a clear understanding of the information provided and the ability to make decisions voluntarily. So when you give a patient the right to make a decision, he must be aware, he must have health literacy. Okay, you must evaluate his health literacy level, and you must evaluate his competency level. Is he competent to make decision or not? Sometimes, if the patient is not competent, for example, has a mental or psychological condition that affects his competency to take decisions, for example, also in case of addicts, their competency is affected to make decisions. Okay, so you must evaluate the level of his health literacy at first, and then the competency of the patient to take independent decision. Autonomy grants every competent adult patient the absolute right to do what he wishes with his own health care. So every human being of adult years with a sound mind has the right to determine what shall be done with his own body. And this is very, very important. The patient autonomy is a concept derived from the property right issues. Okay? As we have the right to do whatever we have to do with our properties, what about our bodies? We can have the right. Okay? Each patient has the right to have his wishes carried out in the events that he in his body. Okay, but if he lose consciousness or the capacity to make decision, or his competency to make decision is affected, then he lose his right of autonomy. This is, for example, the informed consent in Egypt for COVID-19 vaccine. It must be signed by the patient as well as witness, as well as the health service provider. Also, shared decision making is a very important aspect of autonomy. Okay, it means that there is a collaboration between healthcare professionals and patients in the decision-making process. We negotiate rather than ordering. Healthcare professionals provide balanced information about the treatment options, also discussing the potential risks and benefits, and then exploring the patient values and preferences. Necessary support can be provided by involving family members or providing educational materials to the patient to help him to take decision concerning his case. Here is the first case scenario. Sarah is a 45-year-old patient. She has been diagnosed with a serious medical condition. After discussing the treatment options with her healthcare provider, she expresses a desire to explore alternative therapies instead of the recommended conventional treatment. She believes that these alternative therapies align better with her personal beliefs and values. What ethical principle was presented in this case scenario? Is it autonomy or beneficence or non-maleficence or justice? If you know the answer, please write the number of the answer in the chat box. E. Okay. Dr. Adel, Dr. Naz, any other answers? Dr. Ahmed, okay. Okay, Dr. Yasmin. Okay, Dr. Ashwaq. Very good. It's Dr. Rana. It's A. And Dr. Abdul Latif, yes, it's A. So here the answer of our case is A. It is autonomy. Sarah healthcare provider strongly believes that conventional treatment is the best option for Sarah condition. They are concerned about the potential risks and lack of scientific evidence associated with the alternative therapies she wishes. What should the healthcare provider deal with Sarah's request for alternative therapies? Here, the healthcare providers has concerns about the alternative therapies. The choices are respect Sarah's autonomy and discuss the risks and benefits of both options. Persuade Sarah to only consider conventional treatment for her own well-being. Ignore Sarah's request and proceed with the recommended conventional treatment. Seek a second opinion and involve a bioethics committee to make the decision. What is the best answer here? And if you know, please write the number of the answer. D, some of the answer is D, seek a second opinion and involve a bioethics committee to make the decision. Okay. In this case, if she knows what are the risks and the benefit, and she wish this type of treatment, we have to respect and honor her choice. So the correct answer here is to respect Sarah's autonomy and discuss the risks and the benefits with her. Seeking a second opinion if there is what if the second opinion says that the best treatment is the conservative treatment or the traditional treatment? Still, we have to respect her choice as long as she is competent, as long as she knows the risks and the benefit. You can make her sign a consent that this type of treatment is her own choice. So here we will respect her choice. Okay? It is a medical legal reason problem. According to where are we, according to if it's still the treatment is proposed, it's an option. If it's a medical legal problem, so the alternative therapies will not be an option. Okay, here in the case he says that the alternative therapies are option. So here we have to respect Sarah autonomy and discuss the risks and the benefits with her. Autonomy, of course, represents a patient right to determine his or her own healthcare decision. Okay? You cannot treat her against her will, even if she will benefit from the treatment. Think of your body as a piece of property, such as your house, your car. Okay, if the police don't have the right to search your house, okay, they must obtain a warrant. Okay, so we must have a permission. Yes, we must respect Sarah's autonomy, even if she is going to harm her body. She thinks that as long as she knows the risks and the benefits. Sometimes in the ICU, patient may have the decision to leave the ICU even if their case is very complicated and very critical. What are you going to do? Are you going to keep the patient against his will? No, you are not going to do so. You are going to make a release for the patient against his critical condition. So we must respect the patient will, okay, and the patient preferences. But after giving him the risks and the consequences that will result from his decision. So here we have to respect Sarah's autonomy and discuss the risks and benefits of both options. Beneficence, what is beneficence? Beneficence is doing good for the patient, is the obligation to promote the well-being and best interest of patients. It involves acts in ways that maximize the benefits as much as possible and minimize the harm to the patient. Beneficence may extend beyond providing medical treatment and can include considerations of compassion, empathy, and patient-centered care. Here is another case scenario. John is a 70-year-old patient. He has been diagnosed with terminal cancer. He is experiencing severe pain and discomfort, impacting his quality of life. His healthcare provider proposes a new experimental treatment that shows promise in alleviating his symptoms and potentially extending his life. What ethical principle was presented in this case scenario? What is the ethical principle? Yes, number. Okay. Any other answer? Yes. Okay. B, beneficence. اوكي. دكتور عادل، دكتور باسم. اوكي. دكتور محمود، دكتور الرشيدي. Okay, yes, the answer is B. Here we are offering the treatment that will help the patient, that will make good for the patient, and the answer here is B, beneficence for the patient. Non-malfeasance. We are going to discuss the third principle here, which is non-malfeasance. Non-malfeasance is very, very important, and it was illustrated by the Hippocratic Oath as first of all, do no harm. Do no harm. If you are not going to benefit the patient, please not harm the patient. The non-malfeasance was the base of another new discipline, which is called patient safety. Okay, so non-malfeasance means, first of all, do no harm. Don't harm the patient. Healthcare professionals often encounter situations where treatment options may carry potential risks. Balancing risks and benefits is crucial in ensuring that patients receive appropriate care while minimizing harm. In order to achieve this balance, healthcare providers engage in a process called risk-benefit analysis. You compare between the risks and the benefits, okay? You must have a favorable risk-benefit ratio. Examples for applications of non-malfeasance in healthcare, for example, avoiding unnecessary procedures. Carefully consider the necessity of invasive procedures and recommend interventions justified by the patient's conditions and also potential benefits. Minimizing side effects. Consider potential side effects when prescribing medications, selecting options that minimize harm to the patient. Ensure the patient's safety. Adhere to established protocols and best practices to prevent medical errors, infections, wrong patient identifications, wrong surgeries, patient falls, and other adverse events that can harm the patients. Here is the third case scenario. A 40-year-old patient, a 40-year-old patient, here it is Mrs. Samir, has been diagnosed with a severe bacterial infection. The healthcare provider is considering two antibiotic treatment options. Option X, which is a well-established antibiotic with a low risk of side effects, and option Y, which is a newly developed antibiotic with a higher success rate, but a risk of adverse reaction. Which options aligns with the principles of non-malfeasance? Option X, as it carries a lower risk of side effect, or option Y, as it has a higher success rate, or neither option aligns with non-malfeasance, or both options aligns with non-malfeasance equally. What is the correct answer in this case? Yes, it is option A. Here we have an answer which is option A. Any other answers? Dr. Abdelatif say option B. Dr. Ahmad Gabr A. Other answers? Is there other answers? When we talk about option B, which is Option Y, as it has a higher success rate. When we talk in terms of success rate, we talk here about beneficence to the patient. But non-malfeasance means avoiding harm to the patient, avoiding harm with the patient, or avoiding harm to the patient. Here it aligns with choice A. Option X, as it carries a lower risk of side effects, is the correct answer. Okay. Okay. What about justice? Justice is the last ethical principle. Justice is an ethical principle that involves treating patients fairly, neutrally, and equitably. It ensures fairness in the distribution of the healthcare resources, the fairness in the access to care, and the fairness in the avoidance of discrimination. These are all dimensions of justice. Healthcare providers have a responsibility to ensure equitable treatment for all patients, regardless of factors such as race, gender, socioeconomic status, or cultural background. Access or universal access of the patients to healthcare services is very, very important. Here is the fourth case scenario. A healthcare provider is responsible for deciding who will receive an available liver for transplantation. There are two potential candidates. Candidate A, he is a 50-year-old patient with a moderate liver disease, but has been on the waiting list for a longer time. And candidate B, a 35-year-old patient with a severe liver disease, but has been on the waiting list for a shorter time. Which actions demonstrates the principle of justice in this case? To prioritize candidate A as they have been on the waiting list for a longer time, or candidate B as they have a more severe liver disease, or denying both candidates the opportunity for a liver transplant, or randomly selecting one of the candidates for the liver transplant. Which choice from these choices will reflect the principle of justice? If you know, please mention. Okay, we have here, we are not asking about non-malfeasance here. We are asking about the justice. Which one will reflect the justice? If you choose B, you will choose B because of the severity of the disease, okay, based on the severity of the disease and his age, okay? So you are here, you are discriminating between the two patients according to their age. Both have the right to get the treatment, okay? Both can, yes, denying that both candidates have the opportunity for a liver transplant. You will not give any one of them the opportunity for the liver transplantation. Why? Here, in terms of justice, you are going to choose candidate A because he have been waiting for a longer time, okay? In your clinic, if you have two patients, okay, one with a more severe case than the other, who will enter for examination first? Of course, the one who has been waiting. Okay, so in terms of justice, you will choose candidate A. Yes, we will. Here is not the result of the end result of your choice. Okay, we are asking about one thing, is the principle of justice. If you apply the principle of justice in choosing who will get the liver, or who will the liver will be transplanted to him, okay, we will use the 4 principles, okay, to make the choice, not one principle. We will use the principle of the beneficence, the non-maleficence, the justice, okay? And then we will consider the whole picture, and we will take the decision. But here the question is on the principle of justice only. Confidentiality. What about confidentiality, and what is the meaning of the confidentiality of the patient? Confidentiality is the obligation of the healthcare providers to protect the privacy and confidentiality of patient information. What is the difference between the term privacy and confidentiality? Privacy always is in terms of the setting, okay? Confidentiality is in the term of information and data of the patient. Confidentiality is a fundamental principle that ensures the trust and confidentiality between healthcare professionals and patients. Healthcare professionals should keep all patient information confidential, including their medical records, their test results, their treatment plans, and their personal information. This means that patient information should not be shared with others without the patient direct consent. This confidentiality can only be violated when there is a potential harm to a third party, or if there is a court order demanding the information. So if there is a harm to a third person, you must disclose the information, or if there is a court order demanding this information. Here is our 5th case scenario. A 42-year-old man is hospitalized with chest pain. The patient is awake and alert. His wife comes to you demanding information about the patient, saying that she is his wife. She shows her identification card verifying this. What should you tell her? What do you have? What is the ideal thing to do? Okay, I'm not asking about our current practice, but I am asking if this is a question in an exam. What are you going to write? What is the ideal thing to do? What should you tell her? Are you going to give her the information or no? Are you going to give his wife the information about the patient? Right, yes or no? Okay. The ideal, if this question is from the USMLE exam for medical ethics, the ideal is no, or yes, but after the patient consent or the patient permission to do so. So the ideal correct answer is not giving her the information unless you take a permission from the patient, because in this case, he said that the patient is awake and alert, okay? So you cannot release medical information to anyone about a patient unless the patients give you permission to do so. Although it may seem rude and unreasonable, you must tell the patient family members that you must ask your patient for permission before you can release his medical information. In this case, the wife becomes very angry and storms off the floor, threatening to sue you. You apologize to the patient for upsetting his wife by not speaking with her about his private medical problems. Here's the surprise was the response of the patient. The patient was very grateful to you because you didn't tell his wife about his condition. Here's the patient response and say, on the contrary, doctor, you did great. Although she is still my wife, we are finalizing our divorce and we don't live together. I expect to be divorced and remarried within the next few months. She only wanted information about me to use against me in the divorce proceeding. Thanks for protecting my confidentiality. So sometimes there are things that we don't know, okay? The relation between the husband and his wife, maybe he doesn't want that he doesn't want his wife to know about his condition, okay? So what do you learn from this situation? What we learn from this situation? We learn that confidentiality is a fundamental principle that ensures the protection of patient privacy and information. In a situation where a patient wife demands information about the patient, even with verification of their relationship, healthcare providers must prioritize the patient confidentiality. The patient confidentiality comes first. Also, healthcare providers should not disclose any information without direct consent from the patient. Apologizing to the upset wife and reassuring the patient of their commitment to confidentiality was very essential. Also, the situation highlights the importance of confidentiality in safeguarding the patient right, even in complex relationship dynamics. Also, by protecting confidentiality, healthcare providers uphold trust, promote open communication, and respect patient privacy and confidentiality. So it is very, very important not to disclose information about patients unless, okay, they give permission to do so, as long as they are alert and awake. What or when we can break confidentiality? Confidentiality can be disclosed only to prevent harm to others, okay? For example, a mentally ill patient told the psychiatrist of his intent to harm someone. In this type of case, the physician must inform the law enforcement. Here, confidentiality is broken okay, to prevent harm to others. Here, the confidentiality of the patient is no longer a right as long as he is going to harm another individual, as long as it will affect, okay, the right of another individual to live. So we can here inform the law enforcement about the intent of this patient. Another example is other cases in which it is lawful to break confidentiality, including partner notifications for sexually transmitted diseases such as syphilis and HIV. If you have a patient with HIV refusing to notify or to tell his partner, you have the authority and you have the legal immunity to tell his partner. The patient right to confidentiality in such cases is less important than another person's right to safety. However, all efforts must first be made to enlist the patient to inform his partner. In this case, if you have a patient who have HIV and he refuses to tell his partner, you must encourage him, okay, to tell his partner. After many trials to encourage them and he still refuses or didn't tell his partner, you have the legal immunity to report to the health department or to directly inform his partner. You have the legal immunity to do so. And of course, the situation will differ from a country to another according to the rules in your countries, according to the laws in your countries. Here, for example, in Egypt, we have the National AIDS Program. It has its own protocols in tracking the contacts and notification of the contacts, okay, according to how is the protocol of management of HIV cases and their partners and their contacts, okay, you will here take actions according to the used protocols or guidelines in your country or in your institution. What is an ethical dilemma? What is the meaning of an ethical dilemma? An ethical dilemma is the conflict between moral necessities. What is the right thing to do? It is always about what is the right thing to do. What is medically right versus the patient preferences? What is best for the patient versus what is the best for the society? Sometimes the conflict can arise between the patient and his relatives, the patient and his doctor, the doctor and the relatives of the patient and the law, okay? All of these are conflicts that leads to ethical dilemma. For example, a conflict can be between the confidentiality and the duty to warn. Situation where a patient discloses intent to harm self or others will create tension between keeping information private versus preventing the harm. As we have said in the previous example, where the patient was going to harm someone or kill someone. The conflict may arise during a resource allocation. the limited healthcare resources and the need to prioritize is a common situation, especially in limited ICU beds and who would receive the treatment. And we faced this problem during the peak of the COVID-19 pandemic. It was a very, very common problem. Surrogate decision making. The challenges of determining the patient wishes when they cannot express themselves, especially in case of complex family dynamic and conflicting opinions about aggressive versus palliative care. Sometimes the patient doesn't want to undergo surgery, but his relatives want him to do the surgery. Okay? In this case, there is a conflict, there is an ethical dilemma. How to analyze an ethical case? How are you going to analyze an ethical case? First of all, you must know what is being proposed. What is being proposed in this case? What are the medical issues? What are the risks? What are the benefits? What are the alternatives? What are the laws in the country? Okay. And the procedures and policies in your institution. Then you must ask, who are the stakeholders? The stakeholders may be the patients, the family, the medical staff, the hospital, the community, the law. Then you must ask, what are the cultural and religious concerns? Well, the cultural and religious differences in a certain place will affect your decision in an ethical case, of course. In ethics, we don't have what's white and what is black. We always play in the gray area. And in this gray area, you must respect the cultural and the religious background of the ethical case. Then you must ask yourself, when does this need to be done? Is it an emergency situation? Okay, or it is not an emergency situation and you have time to resolve it. And you must know why this ethical dilemma has been created. Was the conflict between the decision makers and the law and the ethics and the patient, or why the conflict has been created? And then you must ask, how can this be resolved? How this ethical dilemma can be resolved? Can it be resolved by meetings, by buying times, by having consultation, okay, by asking a third party? So we must know how this case can be resolved. Here is an example for how an ethical case is resolved. You must decide what is the problem. You must gather information from the stakeholders, facts, values. You must apply the guiding principles in terms of what are the consequences, what are the rights, what are the duties, what are the available relationships. You must generate an evaluation and take actions, the possible and best options, and then you must reflect this on the future problems by applying solutions that prevent such future problems or conflicts to be created. Who are the stakeholders of an ethics case? The stakeholders, first of all, is the patient, whose medical situation is generating the ethical concerns or question. then the family members or the loved ones of the patient, those close to the patient who may provide input on the patient wishes or values and can be impacted by his or her decisions. The healthcare providers, the doctors, the nurses, other clinicians who are directly responsible for the patient care and proposing treatment plans, the hospital, clinic, administration, leaders, and boards who help to determine what are the running policies and guidelines in your institution, the Medical Ethics Committee, of course, which is a consultation group of doctors and others that review complex cases and offer recommendations, insurance companies, the payers, who may influence what treatment are approved or denied based on the coverage criteria and based on the cost effectiveness of these treatment options. The government agencies, the regulators, like for example, the Ministry of Health or the professional licensing bodies that set standards of practice. Of course, the research sponsors, organizations who fund clinical studies and clinical trials. The community, and the community has a very, very important role as a stakeholder in any ethical case. For public health issues or treatment with broad implications, stakeholders can include advocacy groups and the general public. Advocacy for the community is very, very important. Community engagement in solutions is very, very important. So, in this lecture, we have learned that medical ethics include autonomy, beneficence, non-malfeasance, and justice as fundamental principles guiding healthcare professionals. Confidentiality is very, very important in protecting the patient privacy and trust. Also, upholding these principles will ensure the patient-centered and ethical care. Any questions before we proceed to our next presentation? Any questions? Okay, I will share with you the coming presentation. Okay. Do you see the presentation? Is it clear for you? Is the presentation clear? Can you see it? Yes, okay, good. What about medical ethics and HIV-related issues? In this presentation, we are going to discuss several HIV-related issues and their medical ethical background. Confidentiality. Confidentiality is very, very important from the side of the physician in all cases of medical practice. However, due to the social stigma related to HIV or AIDS, there must be an additional layer of confidentiality and consent required. So in ordinary cases or ordinary patients, confidentiality is very, very important. In HIV patients, there must be additional layers of confidentiality and consent due to the social stigma related and linked to HIV cases. When a patient enters the hospital or other healthcare facility, of course, there is a general consent given that allows the routine testing of blood for chemistry and hematology and so on. In case of HIV patients, there is additional HIV-related consent required to test for HIV. When a patient signs a release to distribute or transmit medical information, there is an additional request or consent required for HIV or AIDS-related information. You cannot mandate automatic HIV testing of patients without their specific informed consent that you will be testing for HIV, even if you are in a country with a high prevalence of HIV. So extra protection measures and extra confidentiality and consent measures are done and performed in case of anything concerned with HIV. It is very important to take into consideration that you cannot perform a HIV testing without an informed consent from the patient to do so, even if you are doing so to help or to benefit the patient. You will be subjected to legal issues. Okay, here this will be a case of medical legal issues. Okay. For example, if a woman comes at 10 weeks of pregnancy for prenatal care, she has a history of sexually transmitted disease such as gonorrhea. You offer HIV testing, which the patient refuses as a routine part of her perinatal care. She returns at 12 and 18 weeks of pregnancy, but is still refusing because of anxiety that she may be positive. You inform the patient that there are medications that can reduce transmission from mother to child to less than 2%. She persists in her refusal. What should you do now? In this case, are you going to order the test, or are you going to respect the patient wishes and preferences? She is afraid to do the HIV testing because she has an anxiety that she may be positive. Okay, and you have told her that there is very good medications to prevent the transmission of the mother to the child, even though she still refuses. Are you going to respect her will or not? Okay, the first answer, which is to do, please not to do that. Okay, okay, very good, Dr. Abdelatif, not to do the test. Any other suggestions? Any other suggestion? Not to do, دكتورة سارة. Very good. Mhm. Not to do. Okay, very good, Dr. Adel. Yes, there is a harm to the third party which is her child. Yes, there is a harm. There will be a harm, but a child, a fetus, is considered part of her body because he is not delivered yet, unfortunately. So here, although there are medications to prevent the transmission of HIV to the fetus during pregnancy, you cannot force mandatory testing of pregnant women. The woman has the right to refuse testing as well as to refuse antiretroviral therapy. Unfortunately, in this case, the fetus is considered as a part of his mother body. Okay? You cannot force her to do the test. You cannot force her to take the therapy. So, and if you do so, you will be subjected to a legal problem. Another example is an HIV positive woman comes to labor and delivery at 40 weeks of pregnancy. She has a very low CG4 count, less than 50, and a high viral load, more than 500,000. And these figures tell us that the baby could have the virus, or the virus could be transmitted to the baby. You offer her a cesarean section and intravenous zidovudine, which can cut the transmission rate in half, even on the day of the delivery. The woman is anxious, but clearly has the capacity to understand the effects of this decision on both her health and the health of her child. She is still refusing the cesarean section and medication. What should you do next? What can we do? Can we force her or not? Yes, the baby still is a part of her. After 1 second of being delivered, he is considered a separate individual. Not okay. Very good, Dr. Abdulatif. We cannot force her to do anything. Any others? Yes, Dr. Adel. Yes, Dr. Sarah. We cannot force her. Yes, we cannot. Thank you, Dr. Ahmed. We cannot force her. Of course, we cannot force her. The cases that I am presenting to you in this lecture are from the USMLE cases in medical ethics. So the correct answer here is we must respect her autonomy. The autonomy of the mother is legally superior to the beneficence for the fetus. Although a 40-week fetus is a viable child, the fetus is still inside the woman's body and doesn't become a person until it is delivered. A woman has the right to refuse HIV testing in pregnancy and to refuse antiretroviral medications in pregnancy and to refuse a cesarean section even if it will markedly benefit her child. What about the partner notification? What about notifying the partner that his other partner has HIV? The high level level of confidentiality concerning HIV can only be breached under very specific circumstances, such as when the health of a third party is at risk, and here the partner is considered a third party. A circumstance such as this would be when an HIV positive person has a sexual or needle sharing partner that is at risk. The method of notification follows the steps of first counseling a patient to notify his partners by his will. By another meaning, you encourage your patient to notify his partner. If the patient is either emotionally unable or unwilling to notify their partner, the next step is to notify the Department of Health to start the process of contact tracing. So if this case comes to you, you will choose first is to encourage the patient to notify his partners. If this option was used for several times and failed, okay, you will proceed to the next step, which is notifying the Department of Health to start the process of contact tracing. The health department in this case interviews the patient and attempts to construct a list of his sexual partners in order to notify them. The health department then sends notice to the partner that there is a health-related issue to discuss, and the partner is notified in person of their potential exposure to HIV. At this point, the voluntary confidential testing is offered. Of course, the name of the source patient is never revealed to the partner, and the confidentiality of the original partner is maintained. Here, the confidentiality of the original partner is maintained because in the West, they may have multiple sexual partners, but in Arab region, the confidentiality of the partner, of course, will not be maintained because here it will be most commonly between a wife and her husband. So outside or in the West, they don't tell him about who was the source patient, okay, to maintain the confidentiality of the original partner. So if encouragement of the patient to notify his partner failed, you will proceed to the next step, which is to notify the health department. If a patient will not notify his partners and you have certain knowledge of the partner at risk, for example, if there is a family that you are the doctor of the family and you know the partner of your patient, you have legal immunity to carry out the notification yourself. There is legal protection if you don't notify the partner, if you do notify the partner, but it is not mandatory for you to do so. So if you want to go and inform the partner, you can do. No one has ever been successfully prosecuted for violating a patient confidentiality if it is to warn another person who is at risk. But you don't have to do so, okay? You can notify the health department. For example, you have a patient in your clinic who is accompanied by her boyfriend. She is clearly having unprotected sex because she is pregnant. When you ask her if her boyfriend knows her HIV status, she says, of course not. he might leave me if I told him. You have a protracted discussion about the critical importance of not putting her partner at risk. You strongly encourage her to tell him her HIV status. On a subsequent visit, when you ask her if she has notified her partner, she says, not yet. You know the boyfriend because he accompanies her to the office visits. What should you do? Will you tell her boyfriend or not? Are you going to tell her boyfriend or not? Yes or no? Okay, yes. Yes, you can tell him. Okay. Dr. Abdel Latif, if you are if you are not going to tell him, what are you going to do? Okay, Dr. Radwa, yes. Moral issue to warn him. Yes, it is moral, it is ethical to warn him because he has the right to live. Okay, Dr. Abdel Latif, you choose not to tell him, but that you will notify the health department. Okay, this is another correct choice. So the correct choice here is either to notify her partner directly or tell the health department to notify her partner. Okay, very good. So here you have both a duty to the patient in terms of her health care and her confidentiality. However, you also have a duty to protect the partner. You have legal immunity if you notify the partner. At this point, either you can ask the health department to notify the partner or you may do it yourself. If the partner were to seroconvert for HIV and you did not make sure he was notified, okay, you would be legally liable because you don't follow your duty to warn. This is similar to having a psychiatric patient who told you he was going to harm someone. Also, you have a duty to maintain the confidentiality of the patient, but above this duty is the duty to protect someone or a person at risk. Okay, you will save his life. You are going to protect him from HIV. What about if the health worker is HIV positive? What about in cases that the HIV is the healthcare worker is himself HIV positive? What are you going to do? Or what he has to do? The rule here is that there is no duty on the part of an HIV positive healthcare worker to inform his patient of his HIV status because HIV is relatively a weak virus, okay, compared to a virus like hepatitis C. Universal precautions are supposed to be maintained. These should protect the patients. An HIV positive physician who practice high-risk surgical and obstetric procedures is expected to maintain precautions to protect the patient from transmission. This is according to the USMLE exam, according to the practice of medicine in the USA. Okay, but this rule may differ from a place to another. But of course, we are not going to inform his patients. Okay, so there is no duty to inform the patient that he is an HIV positive. What about refusal to treat HIV positive patients? Some doctors or some healthcare providers refuse to treat HIV positive patients. It is ethically, of course, unaccepted to refuse to treat HIV or take care of HIV positive patients because they are HIV positive. Here there is what's called social stigma against HIV positive patients. If you have a physician to whom you refer patients for different treatment, it would not be ethical for that person to discriminate only on the base of the patient being HIV positive. Here we force the patient to do something very, very bad, is to become silent. Don't tell others that they are HIV positive because of their fear of the social stigma. On the other hand, you cannot force the physician or the doctor to take care over the management of any patient if the physician doesn't want to do so. So here, if it was a question, okay, for you, the best answer is to refer the patient to someone else who perform the care. So if you have an HIV positive patient and a doctor refuse, for example, a dentist refuse to treat him, the best choice for you is to refer the patient to another doctor. Here is a case study. A 32-year-old pregnant woman come to your perinatal clinic. She has a history of syphilis and gonorrhea in the past, but her VGRL is negative now. An HIV test is offered as a routine part of her perinatal evaluation, as well as because of the history of the previous sexually transmitted diseases. You explain to her the importance of the test for her baby's well-being. She refuses the test when offered. What should you do? What is the best choice here? No test. She has the right to refuse. PCR RNA viral load testing is an alternative. Consent for HIV testing is not needed in pregnancy, but it is to protect the health of the baby. Add the test to the other routine tests that are to be drawn. Administer empiric antiretroviral therapy to prevent perinatal transmission. HIV testing is now part of routine perinatal care, and no specific consent is needed. What is the best thing to do? What is the best appropriate action to do in this case? Excellent. A. No test. She has the right to refuse. Thank you, دكتورة سميرة, دكتور عادل, دكتور أماني, دكتور محمود, دكتورة رضوى. Okay. Thank you all. Here, and دكتورة نازك, here the right answer is A. No test. She has no test. She has the right to refuse. Okay, very, very good. Excellent. Now we will have the break for 15 minutes and we will come back to solve the rest of our case studies. Thank you all. Meet you after the break, inshallah. Okay, we are back. I will share the lecture with you now. Okay. The last case was about a 30-year-old pregnant woman who came to your perinatal clinic. She has a history of syphilis and gonorrhea in the past, but her FDRL is negative now. An HIV test is offered as a routine part of her perinatal evaluation, as well as because of the history of previous sexually transmitted diseases. You explain to her the importance of the test for her baby's well-being. She refuses the test when offered. What you should do, as you all said, no test. She has the right to refuse. Patient cannot be tested for HIV against their specific refusal. This is true even if the case of a pregnant woman when the baby's health is at the stake. In fact, HIV testing requires an additional layer of consent, even though it is only a blood test. Here, this blood test is considered an invasive, potentially complicated procedure, the same as surgery and endoscopy, which requires an additional consent because the risk of death and morbidity associated with these invasive procedures. In general, blood testing for chemistry or hematology does not need a specific or additional consent beyond the general hospital consent. But in the case of HIV, well, this is not true in the case of HIV test. We need a consent. Here, the woman's right to choose the management of her own body outweighs the right of the fetus. An undelivered fetus is not considered a person in the legal sense. This is why you don't have to do the test. She has the right to refuse. Case number 2, you have a patient who is an HIV positive physician. He recently found that he is HIV positive. He is very concerned about confidentiality, and you are the only one who knows he is HIV positive. He asks you who you are legally obligated to inform. What should you tell him? His insurance company, state government, his patients only if he performs a procedure such as surgery where transmission can occur, no one without his direct written consent, his employer, the hospital human resources department. What should you tell him? Which choice? Okay. We have discussed in case we have discussed the case if the doctor is HIV positive in the post lecture. Okay, what we have said in this concern is that we don't have to inform anyone if the doctor is HIV positive, and as long as he is not putting others at risk. You don't have any mandatory obligation to inform the state or his insurance or his employer. Okay? Also, you don't have a mandatory obligation to inform his patients. Okay? Even if he was a surgeon. Because HIV is not considered a highly infectious disease unless you take all the universal precautions of infection control. The rule in healthcare, yes, Dr. Adel, the rule is in healthcare is that all patients are considered infectious and we take all the universal precautions of infection control. Okay, so here, if you apply the universal precautions for infection control, the doctor will not infect others. In case that the patient is HIV positive, you will treat him. The same in the case if the doctor is HIV positive physician, the correct answer here is no one without his direct written consent. And here I will repeat again and again, this is regarding the USMLE exam and the practice of medicine in USA. In other countries, the rules and the policies and procedures may differ from place to another. Okay, these cases are from the USMLE cases in the medical ethics. So here the correct answer is no without his direct written consent. We don't have to tell anyone without the direct written consent of the doctor. The next case. So here the correct answer is E. The third case, you have an HIV positive patient in need of drainage of a dental abscess. There is a dentist in your multi-specialty group practice. He knows you are an infectious disease or HIV specialist. Your office manager tells you the dentist and his staff are scared of your HIV positive patients and they don't want to see them. What is your response? This is illegal. The dentist is liable and can be sued. You can contact the medical director and have him instruct the dentist to see the patient. You prescribe the use of oral antibiotic alone instead. Refer your patient to another dentist outside of your group practice. What is the best or the appropriate answer here? Yes, very good. Yes. In case that the doctor refuses to treat a patient, the best choice here is to, yes, number G, refer your patient to another dentist outside of your group practice. Of course, it is unethical for a physician or a healthcare worker to refuse seeing a patient based on his disease. Okay? But also refusing to see a patient is not illegal. It is, yes, unethical, but it's not illegal. You cannot force the dentist to take your patient without his consent. So here, reporting the condition to the medical director will not help because he cannot force the dentist to see the patient. And oral antibiotics, of course, is not sufficient. And the case, the action is, the case is unethical, but it is not illegal. So refer your patient to another dentist outside of your group of practice. We will move now to the fourth case. The fourth case, you are evaluating a new patient that has come to your clinic for management of his HIV infection. He has a high CD4 cells and a low viral load and doesn't require treatment. He is married and doesn't practice safe sex with his wife. His wife is unaware of her husband's HIV status. What is your duty? Encourage discussion between the husband and wife and strongly suggest he disclose his HIV status to his wife, or you must keep his HIV status entirely confidential at all times. Have the city department of health inform the wife. Send the wife a letter to come to your office because of an urgent health issue and then inform her yourself. There is no need for partner notification as long as they are practicing safe sex. What is the correct answer in this case? Excellent. دكتورة نازك، دكتور عبد اللطيف، دكتور حسين. Very good. دكتور أنور. Excellent. If in the choices is to encourage, yes, Dr. Ahmed, is in the choices is to encourage discussion between the husband and wife, you will choose to encourage the discussion between the husband and the wife. Yes, this is correct. Very, very good. So here the correct answer is to encourage discussion between the husband and the wife, as you have a duty to protect the privacy of the patient as well as to protect the health of the third party, which here is the wife. So you have to encourage the discussion between the husband and the wife. The fifth case. You have an HIV positive patient in the office. You ask her if she has informed her partners that she is HIV positive. She has repeatedly resisted your attempts to have her inform the partner. She is pregnant with his child. The partner is in the waiting room and you have met him many times. What should you do? Inform the partner now, respect her confidentiality, refer your patient to another physician who is comfortable with her wishes, tell the partner to practice safe sex from now on, but don't tell him her HIV status. What is the best choice in this case? Very good. Very good. Very good دكتور عبد اللطيف، دكتورة نازك، دكتور حسين، دكتورة دلال، دكتور عبدو، دكتور أحمد، دكتور أنور، دكتور بشير. Okay, and another answer from iPhone. All of these answers are correct. Yes, it's A. It is to inform the partner now. You have legal immunity to inform the partner, and I will repeat and repeat and repeat according to the USA medical practice rules and procedures. Inside the USA itself, there are different, the states are different in applying different ethical rules, but here there is legal immunity to inform the partner because you are protecting him and protecting his life, which is at risk. So the answer is informing the partner now. Now we will move to another topic, which is the ethics of reporting different types of abuse. What about the ethics of reporting different types of abuse? What is abuse? Abuse is the violating the right of others. And mainly here we are going to discuss the child abuse, the elderly abuse, and the spousal abuse. Okay, first of all, what about the child abuse? Physicians are mandatory reporters of child abuse. If you see a child abuse, or if you are suspecting a child abuse, you have to report this abuse. What does this mean? This means that the physician has a duty to report child abuse even if they feel uncomfortable doing so. There is no option on whether or not to report abuse. You are mandated to report child abuse. Even if suspected child abuse, it must also be reporting. Here, where do you report the child abuse? The reporting is to the Child Protective Services. Should happen immediately so that there can be an urgent intervention to prevent further abuse. So physicians are mandatory reporters of child abuse, and you have to report it at once, even if you are suspecting this child abuse. For example, a 20-year-old woman brings her 7-year-old son into the emergency department for a broken arm. The child has been to the emergency department twice before for various injuries. The mother lives with her boyfriend, who is not the child's father. You have no direct proof that abuse has occurred, and the mother simply states that the child is accident prone. When you ask her whether her domestic partner may be injuring the child, she becomes very angry and denies it. What should you do? In this case, what should you do? Should you report or not? Yes, report, or no, don't report. Okay, دكتورة ناصر, report. Okay, دكتور أنور, report. Very good. دكتور عبد اللطيف, report. Okay. دكتور السوني بشير, report. دكتور أسامة, report. دكتور حسين, report. Okay, دكتور عبدو, report. دكتورة نجلة, report. Very, very good. Does anyone, Dr. Abdurrahman, report? Okay. Does anyone suggest that we don't report? Does anyone goes with not reporting the abuse? Okay, very good. Yes, here the correct action is to report this abuse. Report suspected child abuse cases, no matter what the family says. If they don't, if they tell you no, we didn't do anything for him, the child is accident prone, or they become very angry, or they say they are going to sue you, you have to report. The child abuse laws are very specific in terms of protecting the mandatory reporting against liability. Even if there is no abuse found, the suspected abuser has no standing to file suit against you. If they have discovered that there is no abuse when they investigated for it, as long as you make the report in good faith and you are not intending to harm the other person. In other words, as long as you are sincerely and honestly making the report, there is no liability on your end. Although physicians are mandatory reporters, anyone who has a good reason to suspect child abuse can make a report as long as the same criteria are operating. You must have a reason. First, you have a reason to suspect of the abuse, and you mustn't have any element of trying to harm or embarrass the family. What about the elderly abuse? What is the definition? What is the definition of the elderly? What is the definition of elderly? Who can you say that this person is an elder or in an elderly? At what age? Yes, over 60. Very good. And it is the age of retirement. Age 60 or 65, so both are correct. Okay, so after the age of 60 or 65, this is called an elderly or elder. What if you suspect as a physician that there is an elder abuse? What are you going to do in this case? The same criteria described for child abuse generally apply to elderly abuse because both child and elderly are considered among the vulnerable population to abuse inside the community. But here, instead of reporting to the Child Protective Services, there is Adult Protective Services. Reports must be made in good faith, can be done without liability to the reporter. Of course, the circumstances with elderly abuse are less clear than with the child abuse. Why? Because the elderly person is still a competent adult, okay, who may object to the report of the abuse. He can tell you, no, please don't report the abuse. What are you going to do? Why? Because they may be afraid of repercussions in the home, punishment in the home, or the loss of their home. In this case, there is a debate. What are you going to do if he tells you, please don't report the abuse? Okay, what are you going to do? You must report elderly abuse and partially breaching the confidentiality of the patient. Here you are doing something against the will of the patient. Okay? Why? Because you are protecting a vulnerable person. So in case of a child and elderly, you can directly report the abuse despite of their consent or their approval to do so. So it is very important to note what is the age group of the abused person. Is he a child or is he an elderly? If he's a child or an elderly, you can directly report the abuse. What about the spousal abuse? What is the meaning of spousal abuse? Do you know what is a spousal abuse? Anyone has an idea? Report to the spouse abuse? Yes, the husband or the wife. The husband may abuse the wife, and in some cases, the wife may abuse the husband. What in the case of spousal abuse? A spouse is considered an adult, okay? And an adult has the freedom to report or not. Here, The ethics and legalities surrounding the spousal abuse are somewhat different from those for child and elder abuse. In the case of spousal abuse, you are dealing with an adult patient that is generally competent. Consequently, you don't have the same authority to report the abuse against the wishes of the victim as you would do in case of children of a child or an elderly. So here you cannot report the abuse without a consent or without a permission from the victim, unfortunately. Many victims experiencing spousal abuse believe they are not in a position to be able to leave the relationship or to report the abuse for fear of worse abuse. Consequently, you cannot report the abuse to the police or to anyone else without the express consent of the victim. So, in case of spousal abuse, this is considered an adult competent abuse, okay? You cannot report the abuse, and if you do so, you may be liable to medical legal problems. There must be consent from the victim. Okay, there must be direct consent from the victim that he is agreeing that you notify or report the abuse. For example, a 45-year-old woman comes to the emergency department after having her nose broken by her husband. She has been abused several times in the past. When you tell her you will report the injury to the police, she becomes very anxious and insists you tell no one because her husband is a police officer. What should you do in this case? Would you yes report? No, don't report in this case. Yes, it's very Dr. Adel and Dr. Muhammad. This is a spouse abuse. This is an adult competent abuse. How are we going to report without the direct consent of the victim? Here, she doesn't want to report. She is afraid from reporting. Any other solutions? After her consent. But here in this case, he mentioned in the case that she doesn't want anyone to know. She doesn't approve. Okay, so it's no, not to report the abuse. Any other suggestions for the answer? Any other suggestions? Not to report. We can okay, you will present the case to the ethical committee. Yes, okay, it's an option also. But the ethical committee cannot report without her consent as well. Unfortunately, يعني. All the authority, okay, but we cannot do this without her consent, because when they come, she will say, no, he didn't abuse me, he didn't do anything for me. She refuses to do so. Yes, yes, this is Stockholm syndrome. Yes, Dr. Hazli. Okay, I think also with time this rule can be changed because the certain type of abuse from a husband or a wife is very sensitive issue in the community. Okay, it's called domestic-based violence. It's a type of violence. Call her husband and give advice for him. Yes, it is a good choice if it's present. Call 1919 or 911 is her choice, not the doctor's choice. So, when the patient will not give consent to have the injury reported, you should answer that you will encourage the victim to report or you will offer counseling. You cannot report without his direct consent. Okay. We will move to the case study. The first case study is about an 84-year-old woman is seen by you in clinic for routine management of her multiple medical problems. She comes alone and you notice that she has been losing weight and has several contusions. She is a widow and lives with her granddaughter and her granddaughter husband, who recently lost his job. On questioning, she tells you that her granddaughter's husband does occasionally strike her when he is drunk. He hit her when he is drunk. What should you do? Report the abuse only at her specific request. Arrange for a meeting with your patient and the grandson-in-law. Remove the patient from the home and place her in an adult home. Have a home health aide placed to keep an eye on the patient. Arrange for an order of protection from the police. Report the grandson-in-law's abuse to adult protective services. Speak directly to the grandson-in-law about the problem. What is the best choice in this case? Okay, very good دكتورة نازك، دكتور عبد الرحمن، دكتور هادي. اوكي، دكتور خالد، دكتورة عائشة، دكتور أنور، دكتورة نجلة، دكتور عادل. very good. Yes, the correct answer is F. Reporting the grandson-in-law abuse to the adult protective services. Here, you can report to the adult protective services and you have legal immunity to do so. Okay. The choice of health aides at home is to clean, cook, dress, to maintain the patient needs, but they are not for security. Okay. Calling the grandson-in-law and talking to him may not be effective in this case. Okay. So the best choice is F. Report the grandson-in-law's abuse to adult protective services. Let's move to the second case. You are a resident in the emergency department. A parents come to you furious because the social worker has been asking him about striking his child. The child is a 5-year-old boy who has been in the emergency department 4 times this year with several episodes of trauma that doesn't seem related. Today, the child is brought in with a child complaint of slipping into a hot bathtub with a burn wound on his legs. The parents threatens to sue you and says, "How dare you think that about me? I love my son." What should you do? Give reassurance to the parents and treat the patient's injury appropriately. Ask risk management to evaluate the case. Admit the child to remove him from the possibly dangerous environment. Call the police. Ask the father yourself if there has been any abuse. Speak to the wife privately about possible episodes of abuse. Explain to the parents that the next time this happens, you will have to call Child Protective Services. Report the family to Child Protective Services. Give the parents a referral to a family therapist they can see with the child the following week. What is the best choice in this case? Yes, very good, دكتورة نازك. دكتور عادل. دكتور رضوى. In cases of a child, okay, in cases of a child, the choice is دكتورة سهيلة, دكتورة سارة. Very good. Any other answers? In case of child abuse, it is mandatory and you have a legal obligation, okay, to report directly to the Child Protective Services. So here the best answer is to report to the Child Protective Services. Reporting to the Child Protective Services, even if this situation is confrontational with his family, you have the duty to do so, okay? And you don't have, of course, the authority to remove the child from the custody of the parents. Only the Child Protective Services or the court can do so. So the best choice here is to protect the child by reporting the family to the Child Protective Services. Okay. We will move now to cases, a variety of ethical cases, okay, in medical practice. We will take a look how to deal with such cases. The first case, okay. The first case that you are a resident in the emergency department and I'm sorry. Oh, here is the case studies in the clinical practice. We will discuss here, as I said to you, a variety of ethical cases in the medical practice. You are working at the desk in your hospital when another employee of the hospital asks for information about a patient who was admitted last night with a pulmonary embolus secondary to cancer. You know the details of the case. The person requesting the information states that he is a close friend and co-worker of your patient. He shows you proper identification, proving he is really a co-worker of your patient who also works in the hospital. Okay? Which of the following is the most appropriate response to this request? Give him the information on the patient. Give him the information only if he is a relative of the patient. Inform him that you are not at a liberty to give details regarding the patient without the patient permission. Have him sign a release or consent form before revealing the information. What is the best choice in this case? If you know the choice, please write it in the chat box. Excellent. Very good. دكتور عبد الرحمن، دكتور عادل، دكتور أنور، دكتورة نازك، دكتورة نجلة، دكتور جي اوكي، دكتور خالد، yes دكتورة دلال. very good. This case is under, and Dr. Jojo and دكتورة صافية, this case is under the confidentiality of the patient. The confidentiality is a fundamental right of all patients. Okay, it maintains the patient autonomy in revealing information only to those they wish to be informed. So you cannot do this except after the patient permission. If the patient is alert, okay, and awake, he should tell you what to do. And in the previous lecture, we discussed the case where you didn't tell the information of the patient to his wife. And it seems that he and his wife has major problems and they are going a divorce, and this information was intended to be used against your patient. So, of course, here the correct answer is to inform him that you are not at liberty to give details regarding the patient without the patient permission. Very good. The second case, you are a psychiatrist in session with a patient who tells you he thinks his boss at work is persecuting him. The patient has had mild schizophrenia. The patient asks you if you can keep a secret and then tells you that he is planning to kill his boss when the time is right. You say, of course, everything you tell me during the session will always be confidential. What should you do? Keep the patient session confidential, but make attempts to discourage the patient from his plan. Inform your medical director and let him handle it. Inform law enforcement agencies of the threat to the patient's boss. Inform the patient boss that he is in danger. Inform both the patient boss as well as law enforcement of the threat. What do you have to do in this case? Okay, here Dr. Adel and Dr. Muhammad E. Dr. Naveen B. Why B? Inform your medical director and let him handle it. We are trying to protect the confidentiality, and on the other hand, protecting the third party as much as possible. Okay. Here we are not going to tell the medical director, because what he is going to do is what you are going to do. Okay? Here it comes to safety. When it comes to safety of the patient, of another person, safety comes First, no, I cannot choose A. I cannot keep very, very dangerous informations like this. You have to tell both the patient boss as well the law enforcement of the threat. Because here, the patient right of confidentiality will end. His right of confidentiality ends as long as the person's other person right of safety begins. Your duty will be to protect the life of the person at risk, which is more important than protecting the confidentiality of your patient. When you compare between the confidentiality of the patient, of your patient, and the right of the safety or the life of another person, you will choose to protect the other person by all means. So here, if you have this as a question in the exam, so the best answer is to inform both the patient boss as well as the law enforcement of the threat to protect your patient. Okay? So here the correct answer is E. Inform both patients boss as well as law enforcement of the threat. And if you don't do so, you are liable, okay? You will be liable if the injury happened to your victim. If the injury happened and you did know it, you are liable to be legally sued because you didn't disclose the danger. The danger. Okay? Any questions before I proceed to the next case? Okay, very good. The next case, you are discussing the care of an elderly woman with her family. Although she is awake and alert, the patient is very ill and physically fragile. You are awaiting the results of a biopsy for what will likely to be cancer, which has already metastasized throughout the body. The family asks that you inform them first about the results of the biopsy. They are very loving and caring and are constantly surrounding the patient. They don't want to depress the patient further, and because there will be no hope for a cure, they see no reason to ruin her remaining life with this information. I know that you meet such cases every day in your practice, okay? But here we are discussing the case from the ethical point of view, the ideal ethical action which should be done. This ideal ethical action will vary from place to other, from culture to another, from background to another. Okay, what you should tell them. You will honor their wishes, you agree with their wishes, and you ask them to give you the necessary written consent. You ask them to involve the ethics committee for the hospital. You tell them that you are obligated to inform the patient of all the findings. Explain to them that the decision can only be made by the healthcare proxy. Okay? What is the ideal answer? Okay. دكتور عبد الرحمن G. دكتورة نازك C and G. Okay. Yes. Very good. دكتورة عفاف G. دكتورة حسين G. دكتور أنور G. دكتور عادل G. ايفون G. Okay. Very good choice. Yes, it is the correct choice. يعني حضراتكم دايما أنا بلاقي في الجزئية دي ما باجي أشرحها مشكلة إن الناس يعني مثلا في مصر الوضع ساعات العيان اللي بالحالة دي هو بيكون آخر واحد يعرف أصلا، يعني يمكن كمان يموت وهو ما يعرفش هو كان عنده إيه. فهو فعلا الحل الأيديال هو دي فعلا، هو ده الحل الايديال. and I think it is the ethical one because the patient has right to know what is going in his life. He may take decisions even if he is surviving the last days of his life. Okay, he has to make the decision. uh, uh, so G is the correct answer. You tell them that you are obligated to inform the patient of all the findings. Very good. We will move to the next case. Your patient has recently been diagnosed with familial adenomatous polyposis. This disorder is chronic, progressive, and fatal. Okay? There is a genetic test that can tell whether children of parents with the disease will develop it. The test is very accurate. The patient has become divorced and refuses to give you his consent to inform his ex-wife, who now has custody of their 3 children. He threatens to sue you if you reveal elements of his medical care to his ex-wife. In this case, the patient has a genetic disorder, which is chronic, progressive, and fatal. There is a genetic test that can say if the children of this man has the disease or not, in order to take preventive measures with them or protective measures. But he refuses to do so because he doesn't want his ex-wife to know. What should you do in this case? Respect the patient right to confidentiality. Transfer the patient's care to another physician as long as the patient agrees. Ask the health department to inform the patient ex-wife about the disease risk. Seek a court order to inform the patient ex-wife. Inform the patient's ex-wife of the risk of the children. Inform the ex-wife's doctor. What is the best choice in this case? What do you think is the best choice? Transfer the patient to another physician. Okay. Until now, no one had the correct answer. Yes, it is lethal. The disease is lethal. Yes, it is fatal. Yes. Yes, دكتورة ناصك. Yes, دكتورة Ahmed. Yes. Yes, you have to inform the patient ex-wife of the risk to the children. Here we are talking about a fatal disease that may affect the children. Okay, what is the health department going to do? The health department will also inform the ex-wife. So go and inform the ex-wife if you can. Here, this disease can be preventable, okay, by what's called the colectomy for the children. So, and then it will not be fatal. So it's the best answer is to inform the patient ex-wife of the risk to the children. The health department does not notify for genetic disease. They notify only for HIV, sexually transmitted diseases, or social disease like tuberculosis, HIV, sexually transmitted disease, food or waterborne disease. But in case of the genetic diseases, this is not their duty. So you have to inform the patient ex-wife of the risk to the children. So here in this case, you have to inform the patient ex-wife of the risk to the children. The fifth case, you are a resident invited to a dinner given by a pharmaceutical company. In addition to the dinner, there is a lecture given on a medical subject as well as $500 gift certificate to a department store for attending the presentation. Okay, which of the following is the most appropriate action in this case? It is entirely unethical to accept any of it, refuse everything. It is only ethical to attend the lecture. Don't accept the money, but the dinner and the lecture are ethically acceptable. You may accept all three components. Cash payment from industry are acceptable as long as they are not tied to prescribing specific medication. You can accept because you are a resident and not an attending. Which of the following do you think that is the correct answer? If you know, please write it in the chat box. Okay. Until now, no correct answer. This case is under the cases or the big title of gifts to the doctor. Either the gifts is from pharmaceutical companies or the gift, yes, Dr. Adel, this is the correct answer, is Dr. Rawa. The gifts under the title of the gifts to the doctor. Either the gifts are from the industry or the gifts are from the patients. Okay? Yes, Dr. Dalal. The rule of gifts, yes, Dr. Najla, the rule in cases of gifts from drug or pharmaceutical companies, it is accepted to attend the lecture. It is also accepted to take the meal, okay? And if you are preparing a lecture and giving it, presenting the lecture in you can take a cash reward for this, an average cash reward for this, but it's not accepted at all for members of the audience to accept direct or indirect money for participating. Okay, here it is ethically acceptable to attend the lecture and the meal, but it is not accepted to take the check for cash for the participants. So here the correct answer is that don't accept the money, but the dinner and the lecture are ethically acceptable. So it is very important that you are not allowed to take cash money from pharmaceutical company because they are always surrounding physicians in attempt to influence their prescribing patterns in drugs for their patients. So don't accept the money. Don't accept the money is, of course, the rule here. Here, case number 6, you have been taking care of a patient admitted with palpitations from a panic attack. He is somewhat hypomanic with pressured speech, anxiety, and flight of ideas. After several days, he is feeling much better, and he is extremely grateful for your help. He is quite wealthy, and he offers to borrow $5 million from the bank to help you with your research. What should you tell him? He will give you $5 million for your research. What are you going to do? I accept. Thank you very much, but I cannot accept. I accept, but only for a study of bipolar disorder. I would be happy to take your money, but I must have you evaluated by psychiatry first. What is the rule in gifts of patients? He is not okay, Dr. Nozick, but even if he was evaluated by the psychiatrist and he told you that he is a normal person, would you take the money? Yes, the correct answer is B. Thank you very much, but I cannot accept. We cannot accept such gifts from the patient. Okay, here we cannot accept even, and of course he has a clear evidence of acute psychiatric disturbance. He is not qualified, he is incompetent. The gift must be truly objective and clean in a way that there is no question of acute emotional instability leading to the gift. So here the correct answer is thank you very much, but I cannot accept. The common case, yes, B is the correct answer. Thank you very much, but I cannot accept. You have a patient in your clinic who is an elderly woman with multiple medical problems. Her family is extremely grateful for your care and they bring you a meal. They cooked at home, a cake and a scarf. What should you do in this case? Accept the gift but report it. Accept the gift. Offer payment for the food, refuse the gift. It is ethical to accept the gift if you share the food with the rest of the house staff. Accept the food, but not the scarf. What is the best answer in this case? If you know the best answer, please write it in, sorry. Please write it in the comment box, okay? What is the correct answer? So what is the correct answer in this case? Yes, B. B. Okay, very good, دكتورة دلال, دكتورة نجلة, دكتورة رضوى, دكتورة رواء, دكتورة عادل. Yes. Dr. Ahmed, very good. Here, that is considered a small gift of limited value. Small gifts from patient of limited value are ethically acceptable. Food, plants, small articles of clothing, such as scarf, are all acceptable. Okay, refusing such signs of gratitude, this is like a gratitude from the patient to you, may be hurtful to the doctor-patient relationship. Good relationships, when you take the gift, you will support the good relationship between you and your patients. Okay? And in this case, the gift is not linked to a specific expectation of care, such, for example, as yes, طبعا الرسول عليه الصلاة والسلام قبل الهدية، تمام، بس أهم حاجة إن الهدية دي ما تكونش مربوطة بمصلحة، لأن لفظ الهدية ده بقى يعني مش عايزة أقول إن بقى يساء فهمه. فالهدية طالما مش مربوطة بمصلحة أو توقعات ما يبقى مقبولة طبعا. Gifts should not be linked to specific expectation, or for example a particular prescription or the successful completion of paperwork, زي مثلا like disability forms. Okay, so small gifts of nominal value is accepted. In this case, the scarf, the food, okay, and the cake are accepted. So you here can accept the gift. Case number 8. A physician in a busy inner city environment has developed his practice over the years to the point where he no longer needs to solicit new patients. He does not want to expand his hours of work, so he decides to limit his practice. He instructs his office staff to refuse to accept new patients. Here, the doctor refuses to accept new patient. He wants to follow up only with his old patient. He wants to limit his practice. He wants, for example, to make more hours for his family, for his own life. Okay? Which of the following most appropriately describes his action? It is both legal and ethical. It is ethically acceptable but illegal. He is within his legal rights to refuse the patient, but it is considered ethically unacceptable. It is both illegal and unethical to refuse to accept new patients. It is ethical as long as he arranges transfer of care to another physician. What do you think is the best answer for this case? This case is under the doctor-patient relationship. How can you describe the doctor-patient relationship? Is it a voluntary relationship from the side of the doctor or not? Okay, is it voluntary or involuntary? Dr. Ahmed Gabr, your answer is correct. In this case, it is both legal and ethical. Let us know or discuss why it is both legal and ethical. There is no legal or ethical mandate to care for any patients who comes to see you. Okay, the physician-patient relationship must be entered into voluntarily on both parts, except in emergency. In emergency, you are obligated to give the care to your patient without choosing who to care for and who are not. In this case, the doctor has decided to limit his practice. Maybe he is sick, maybe he is ill, maybe he wants to provide his family with more hours, okay? Maybe he wants to take care of his family more. Maybe he has social problem in his life, okay? As any other career, if you are an engineer and refuse to build a building, okay, or to design a building, it's your choice. It's the same for the physician. He has to choose, he has the right to accept or to refuse to give the medical services unless it is an emergency. So, if the physician practice is full, there is no obligation to accept new patients. It would be unethical if the physician were to accept patients based on some personal preferences, like their religion, like their gender, like their socioeconomic status, and refuse others. Okay, here he refused all patients and not discriminating between his patients and choosing some, okay, and others not. Yes, it's the doctor, right? He is a human being. So, as long as it is not, there is no discrimination in the process of refusal, he has the right to do so. For example, it would be unethical to accept or reject patients on the basis of their race with a specific area of expertise, مثلا. For example, some you have experience more in certain certain variables. So here the choice is that it is both legal and ethical, as long as the physician is not doing this based on any type of discrimination. Okay, but in emergency, he cannot do so. It is forbidden in emergency, or he is obligated to treat and give care to all patients during emergencies. Now we will move to the case number 9. A 60-year-old male physician who is an internist has had a female patient for the last 20 years. Both lost their spouses several years ago. They start spending time together outside the office. The female patient wants to begin a sexual or a romantic relationship with the physician. What should he tell her? I can never do that with you ever. We can be social, but not sexual. We need the ethics board's approval first. I can date you and be your doctor. Maybe in the future we can date after you get another doctor. Because this is your initiative, we can begin dating. What is the best choice in this case? Hmm. What do you think is the best choice in this case? A, I can never do this with you ever. Okay, another answer. No. Unfair. Okay. Number D. Okay, Dr. عبد اللطيف. D, yes. G, دكتور خالد, yes. G. يتجوزوا أحسن. Okay. Any other answer? Okay. Here, the rule in the doctor-patient relationship, a doctor-patient relationship cannot exist, okay, while there he is still her doctor, okay? Once the doctor-patient relationship has ended, another relationship can start, except for one specialty. Do any one of you know the specialty that there cannot be a romantic relation between the doctor and the patient, even if this relationship ends? What is the specialty? Yes, very good, Dr. Ryan. Any other suggestions? Yes, the psychiatry. The psychiatry, you have to look at first what is the specialty of the doctor. If he is a psychiatrist, it is forbidden to make a relationship with his or her patient, even if he has ended the doctor-patient relationship from 20 years ago. So for psychiatry, it is totally forbidden, okay? But for any other specialty, you can first end the doctor-patient relationship and can start any relationship after that. So the correct answer here, I cannot date you and be your doctor. Maybe in the future we can date after you get another doctor. The romantic relation between a physician and a current patient is not ethically accepted, is unethical. At the very least, the physician-patient relationship must stop. The patient must transfer her care to another physician, okay, to avoid the abuse of power in the relationship and to keep clear boundaries. But in case of a psychiatry and a patient, it is generally not acceptable even after the physician-patient relationship has stopped. Okay? Even who has initiated this relationship. So there is no dating services for physicians during duty or during their relation with their patients. Okay, we will move to the next case. The next case is a 40-year-old man comes to see you for routine management when you inquire about multiple scratches and contusions as well as a black eye. He says his wife routinely abuses him and is beating me up pretty regularly, doctor. He denies hitting his wife. You see him a few weeks later and he has a new version of the same injuries. You are very concerned about his injuries and you tell him that you are planning to report the injuries. He very clearly states that he doesn't want these injuries to be reported. What do you tell him? You have no choice but to report the injuries because you are a mandatory reporter. You will report the injury only with his consent. You will honor his wish, but must report it if there is another episode. There is no spousal abuse reporting. You will report it if you find evidence that the wife was really the attacker. What is the best choice here? اوكي دكتور عادل، دكتورة رواء، دكتورة رضوى، دكتورة نازك. اوكي very good. Any have another answer? Other suggestion? دكتورة رضوى. اوكي be right. Yes, here the right choice is that you will report the injury only with his consent. The rules in reporting of spousal abuse or domestic violence are much less strict than those for child or elderly abuse. As long as this is a competent adult, he has the voluntary choice of reporting the injuries themselves in the majority of cases, or ask you to report it after their consent. So here you cannot report the injury except after the consent and the approval of the victim, even if this injury is recurring and returning back again and again with the same condition and with the same type of abuse and violence. Here we have finished our 10 cases. If you have any answer, if you have any question for the post presentation, okay. Any questions? Any question? Okay, now we will wrap up what we have took today. What we have took today, we will wrap up the content. Thank you. We will wrap up the content of our lecture today. لماذا لا يعتبر طفل؟ طيب he is an adult، يعني he is a husband. So he is competent, so he must take the decision to report or not. طيب أنا هعرض على حضراتكم تاني راب أب ملخص سريع للي أخدناه النهاردة. حضراتكم ثواني بس وهشير معاكم. We presented today the relation between medical ethics and confidentiality. What is the most important items in this presentation? The most important items that there are four principles for medical ethics. What are the four principles of medical ethics? Autonomy, beneficence, non-malfeasance, and justice. What is the meaning of autonomy? The meaning of autonomy is that the individual can take independent decision. It respects the patient's right to make decisions about their own health care. It includes what? It includes the informed consent, the patient education, and respecting the patient choices. This is autonomy. Okay? Okay, and there is what is called shared decision making. What is shared decision making? It is an important aspect of autonomy. It is the collaboration between the healthcare professional and the patient in the decision-making process. It is a negotiation process rather than ordering process. Then we learned what is beneficence. What is beneficence? Is doing the good for the patient, the best interest of the patient. It goes beyond providing medical treatment, and it concludes consideration of compassion, empathy, and also patient-centered care. What about non-malfeasance? What is non-malfeasance? Non-malfeasance is according to the Hippocratic Oath, first do no more. So here, the rule in non-malfeasance is first of all, do no harm. And how can this be assessed? It can be assessed through the risk-benefit analysis. Examples for application of non-malfeasance is the avoiding unnecessary procedures, minimizing the side effects, and ensuring the patient's safety. What about justice? Justice is the fairly, neutrally, and equitable distribution of rights and responsibilities among patients. It ensures fairness in distribution of healthcare resources, access to care, and avoidance of discriminations. Healthcare providers have the responsibility to ensure equitable treatment for all patients. What about confidentiality? Confidentiality is the obligation of healthcare providers to protect the privacy and confidentiality of the patient information. You cannot disclose the patient information, okay, unless there is a potential harm to a third party or if there is a court order demanding the information. Here, breaking confidentiality is to prevent harm to others. What is an ethical dilemma? It is a conflict between moral necessities. What is the right thing to do? What is medically right versus the patient preference? What is the best for the patient versus what is the best for the society? The confidentiality versus the duty to warn, the resources allocation, the surrogate decision-making. All of these conditions can lead to conflicts. How can you analyze an ethical case? You can analyze an ethical case by presenting the following. What is being proposed? What are the medical issues, risks, benefits, alternatives, case and legislative law? Who are the stakeholders, patient, family, medical staff, hospital, and community? What are the cultural and the religious concerns of the case? When does this need to be done? Is it an emergency or not? Why is an ethical dilemma being created in case of conflicts between decision makers, laws, and ethics? And how this can be resolved? Can it be resolved by meetings, by buying time, by consultations? Who are the stakeholders of an ethical case? The stakeholders of an ethical case are patients whose medical situation is generating the ethical concerns or questions, family members or loved ones, those close to the patient who may provide input on the patient wishes or values and be impacted by their decisions, healthcare providers such as doctors, nurses, and other clinicians who are directly responsible for the patient care and proposing treatment plans, hospital clinic administration, or the Medical Ethics Committee, which is a consultation group of doctors and others that review complex cases and offer recommendations, insurance companies who are the payers who may influence what treatments are approved or denied based on coverage criteria, governmental agencies, which are the regulators like the Ministry of Health, or the professional licensing bodies, the research sponsor, and the community. Here we have finished our lectures today. If any questions, please write it in the chat box if there are any questions.